Olukemi Olugbede. She's a public health physician, field epidemiologist, and of course, she will be joining via Zoom. And then I will be speaking to Dr. Patrick Eze. World Health Day, and of course, it's all about my health, my right. Stay tuned. Insight Today continues shortly. All right, you're welcome back. And if you're just tuning in, great choice. And look, talking about World Health Day and my health, my right, is celebrated every 7th of April by the World Health Organization, talking about why it's important. Healthcare infrastructure is very important globally when it comes to the nation and the world, infrastructures, and being sensitized when it comes to the health sector. Most individuals out there find it very hard to subject themselves when it comes to great healthcare. Most people do not have access to healthcare. So we're going to be looking at some simple steps individuals can take to improve their overall health. Like I said, I will be joined by Dr. Kemi Olugbede. She will be joining us via Zoom, and she will be here soonest, as we all know. And like I said, most people find it very difficult to get steps to improve on their overall health, how it's hard for some communities to work together to promote better health and well-being, and the role of mental health, how it plays in all of this, the overall health, and how can we address mental health, which is a challenge, and how can technology and innovations contribute to the advancement in healthcare and public health, and of course, some key global health issues that we should be aware of and address collectively. Of course, we know about the coronavirus, we know about Lassa fever, just to mention a few, a lot, monkeypox, so on and so forth, how we can address it, how we can key to precautionary measures to avoid this sort of issues, that health issues who are hazardous to an individual. And like I said, we need to address what it is, why it is very important for public health and healthcare and public health sectors to come in when it comes to an individual's health, and mostly the challenges that we face when it comes to the infrastructure, when it comes to the machines that we need, when it comes to all of these gadgets to improve healthcare and health facilities. Now, like I said, happy World Health International Day. And of course, my health, my right is very important for you to understand that it is of importance to get your health checked. Being healthy is key. Being healthy is of importance. Many individuals find it hard to accept that fact. They feel because of the cost of health, the public health sector, it's easier to get self-medication. It's easier to prescribe your own drugs or meet quacks who will cause detriment when it comes to the health of an individual. All right, now let us just stay tuned. Insight Today continues shortly. And like I said, it's World Health Day. My health, my right. Stay tuned. Don't go anywhere. All right, you're welcome back for that very short break. And yes, it is World Health Day, my health, my right. And I am being joined by Dr. Olukemi Olugbede, and I'm so excited to have her on the program. Hi, Dr. Olukemi, how are you doing today? Like I said, she's a public health physician, field epidemiologist, and she is joining via Zoom. Hi, Dr. Kemi, are you here?
Yes, I am, Madam Jemima.
Oh, Dr. Kemi, it's great to have you on the program Insight today. I am so excited. Thank you for making yourself available.
Thank you for inviting me.
All right. Now, Dr. Kemi, I want to ask some issues. First of all, congratulations. It's World Health Day, my health, my right. Now, what are some simple steps individuals can take to improve their overall health?
Yes, thank you very much for your question. World Health Day is being celebrated globally, and many governments, countries, and public health institutions have been very active, and they've been very, positive about the campaign. The theme for this year is My Health, My Rights. So it is important that people know their rights as citizens, and these rights are rights to universal health coverage. So what that means is that irrespective of your social status or your race or your cultural background, you have a right to access good health care without being pushed into poverty. So essentially, universal health coverage means that wherever people are, they have the right to access healthcare, and that healthcare must be accessible, must be available, must be acceptable to them, it must be affordable, and it must be of good quality. So for people to know their rights, they have to be informed. So health education is very important. Health awareness, just like your amazing program is doing, is important to let people know their rights. It's important for them to have correct and consistent and complete information about the different healthcare services, different essential services that they should be able to get when they go to a health facility or a primary health center or a secondary health center or a teaching hospital. And these services include maternal health, reproductive health, child health, care for the elderly, eye health, and the different components of primary health care, which is the care that is accessible to people in the community at the very basic level. So for people to know their rights, it's important for them to be informed. Then some other rights too are, their rights to privacy, their rights to confidentiality, and then their right to be part of their health management process. So what that means is that, when a healthcare provider is taking care of someone that goes to a hospital or a clinic or any kind of health facility, it is
Yes.
important that they are carried along. You know, it is important that their fears are allayed, they are reassured, they are informed about their diagnosis and their management process. That means they must be aware of their of the different kinds of tests that they need
Yes.
to have, and what the reason why they're having those tests, and the costs, and then options, especially if there are tests that can give the same result, but maybe their costs differs. So they have the right to know what options they have. In fact, they are also, as a patient or someone seeking healthcare, you have the right to a second opinion. If for any reason your healthcare provider has told you that, oh, I have, these are the things that I'm thinking about, and for one reason or the other you're not comfortable with the diagnosis or with the assessment, you can always get a second opinion. So you have a right to that. And then when it comes to the issue of privacy, privacy is a very sensitive issue, especially when it comes to examinations. As a someone seeking healthcare, your health provider might need to examine you if you have complaints about a particular body part or a particular structure, or maybe a particular part of the body is not functioning well, or there's a swelling. The person wants to see where it is, and maybe the size, the shape, the extent. They might say, oh, you need to undress. But if you don't feel comfortable, if, for example, the healthcare provider is male and the patient is female, and there's no chaperone, you can ask. It is your right to ask for a chaperone. Your right to, if there's no chaperone available, for a relative or a family member of the same gender as you to be present, and then your data too should be confidential information between you and your healthcare provider. And if
Now,
you do
I,
not want your
I
data to
want
be shared, you have a right to ask for privacy
Right, I want to
concerning
ask a
that.
question, Dr. Kemi. Like the theme this year, World Health Day, says, "My health, my right." Is it that most individuals do not understand that they have rights when it comes to health facilities, when it comes to that relationship between an individual and the health
Provider.
healthcare provider? Yes, it's that we do not understand what our rights are. That is why the theme is based on my health, my right. Because most of all of these things that you've said, some people do not understand the value in which it holds. That, okay, I have a right to ask questions. It's not what the prescription the doctor gives me that I'll take. I should sit down. He should explain to me what all of these. I shouldn't just take it because he's a professional. So we have all of these rights, which are very important.
Exactly, absolutely correct. So it is important so it's two things. First of all, the theme is just to highlight the fact that health is a fundamental human right. And even though, everybody should have access to healthcare, for one reason or the other, due to different challenges, economic challenges, social challenges, political, issues, wars, conflicts, violence, infrastructural, destruction and all that, especially in places where, there are ongoing wars and all that. People
Exactly.
have, access to health, they don't have it. So the theme is also trying to, shed light on, the different, challenges going on globally. It's a global health issue,
Yes, it is.
especially in some countries where there is ongoing violence and wars, and people are displaced and they don't have access to health because of those situations, which is their right. So that is one. Everybody needs to have access to health, but unfortunately not everybody does. Another thing is the fact that it is important to know that, aside that you have, that health is your right, you should know what those rights are. And that's what we're talking about. That, as health seekers, as patients, as clients, you have a right to, accessible, affordable, acceptable quality health care. You have a right to be carried along and be informed in the processes regarding your treatment. You have a right to privacy,
Exactly.
confidentiality, and respect while you are getting this care or service. And then you also have a right to the provision of basic essential medical services, depending on maybe your age or your gender or your special or peculiar needs.
I
Okay, so
understand.
those are the things that this theme is trying to highlight.
I understand. Now, I want to talk about the role. How does the role of mental health play in overall health? And how can we address mental health challenges? Because we have a lot of that from depression and all of that. How can we address this overall health challenge that most people face when it comes to mental health? Their rights. What are their rights when it comes to mental health challenges?
Yeah, so very, fantastic for you, raising and highlighting that point, because as part of, the health rights that everyone should have access to, it's also, the right to good mental, health and good mental health care, and mental health is a very important component of overall health, even in the definition of health, you know, according to the World Health Organization. It has to do with having complete, is a state of complete physical, social, economic, and even mental well-being. So there's this saying that there's no health without mental health. So a person could be, socially, economically, and maybe physically healthy, but when the mental component of his or her health status is not present, the person is not fully well, the person is not fully stable. So mental health is a very important aspect of healthcare, because it has to do with your emotional and psychological well-being. It has to do with the state of your mind, having a stable state of mind, having balanced emotions, and being able to interact with people in your community, in your society, in your home and workplace, without any, rancor or, challenges. In communication, you are clear, you are easy to understand, and there's no ambiguity with what you're saying. Because once there's a dysfunction at any of these levels, if there's a problem with the mind, or there's a problem with interaction, or there's a problem with socialization, or even how a person sees themselves, then their mental health has been affected. So the mental health rights that people have is that they have the right to be listened to. They have the right to be, understood. They have the right to not be stigmatized or discriminated because of their peculiar, mental health status. That's for those who have maybe mental illness or mental health disorders. They have a right to be taken care of. They have a right to access, the healthcare services like every other person. And then in the process of receiving healthcare, they should be listened to, they should be
Accepted.
accepted, and they should have access to affordable healthcare that can improve their quality of life. Now, what helps people to know these mental health rights is exactly what we're doing now. It has to do with awareness, it has to
Great.
do with information, it has to do with health education, and then disabusing and dispelling, disabusing people's minds and dispelling myths about, mental health or mental
Exactly.
illness. So because there's this impression that people that have mental health disorders or mental illness, they're possessed,
Yes.
they're
They're
they
crazy.
have spiritual problems. They use a lot of terms, degrading terms to describe
Yes.
them, like lunatics or they are mad. Those are very unacceptable words, they are
Yes, it
unacceptable
is. Yes,
terms.
it is.
Because the thing about mental illness is that just the same way a person can have a physical illness, a person can have hypertension or diabetes or malnutrition. It's the same way a person can have mental illness. It
Very
doesn't
true.
mean the person has a spiritual problem, or the person needs to be chained, or the person needs to be whipped or beaten. Those are, that is abuse already. That is degrading, and that is already, infringing on the person's rights. Even if a person has a mental illness or a mental health disorder, they have a right to be protected and to be properly treated. So it is
Very
important
true.
for us to create awareness about mental illness, for people to know that the same way there are physical illnesses, there are mental illnesses. And many times, especially when it comes to things like anxiety or depression, there are not things that people can just wish away, or just, when people say things like, oh, snap out of it. It's not something people can snap out of. Many times they'll need emotional support,
Yes.
psychological support, counseling, therapy, even, depending on the severity, they might need medication as well, and
Very true.
rehabilitation. So it's very important that, we strengthen the mental health services in our country, especially at the public level. There's been a lot of support at the private level, private sector level,
True.
NGO, and a lot of advocacy groups, and a lot of virtual consultations by new mental health organizations. So in the public sector, what needs to be done is to strengthen, the mental health at the grassroots level, okay, and to also strengthen the referral system at the secondary and tertiary level,
Okay.
such that when people are, detected to have, mental health challenges, then they can be referred on time, so that they can get better on time as well.
Okay.
So instead of taking people to places for deliverance or where they'll be
I was going to
beaten,
mention that. Funny enough,
change. Yeah, they should be
I was going to
taken
mention that.
they should be taken to the hospital. They should be taken to a
Exactly.
clinic or
You
a health facility that has the capacity to take care of them. And the people that
exactly.
can take care of these people are mental health specialists. They could be psychologists, they could be
Yes.
psychiatrists, they could be mental health therapists, and a lot of rehabilitation centers are also springing up, because there are very few psychiatric hospitals in Nigeria at the
Yes. Yes.
moment. So there's one in each geopolitical zone, but it's
Yes.
been seen
Yes.
that they are overwhelmed, and the human resources for mental health in Nigeria has significantly depreciated. A lot of
Yes. It's
mental health,
limited.
practitioners have vacated, and right now, for those that are remaining, they are less than 300. And considering
Wow.
our population, that means we are seeing only just maybe one psychiatrist to about 1 million people.
Wow.
So we need to strengthen the healthcare system and train more people, in mental health care, so that they can also, ensure that the rights of people who have mental illness or mental health disorders are protected, and those that are even sort of at risk do not tip over and become severely ill, because there's so much stress and challenges that can tip people into becoming mentally
Not talking,
unwell.
still adding stigmatization that's attached to all of these mental health issues. All right, Dr. Kemi, I want to ask you one last question before I wrap it up at about this point. Now, let's talk about technology and innovations. How do they contribute to the advancement in healthcare and, of course, public health?
Yes, fantastic question. So technology has been a very, useful tool in medical, in delivery of medical services. There's so many innovations and technology that is being used to make our work easier, especially when it comes to diagnostics. Even before, one of the things that made technology a very veritable tool in delivery of health services was COVID. So a lot of people had to
Exactly.
find creative means to assess patients, to that's in terms of accessibility, and then in terms of being able to assess what is wrong with them. So even though there was a pandemic, there were lockdowns, there were restrictions with movements, people were still able to consult online, so that was an innovation that was applied, that's telemedicine, virtual consultations, see a doctor,
But Dr. Kemi,
irrespective of your
I
location.
want to ask a
So
question.
telemedicine has been very useful. And then the use of artificial intelligence too for diagnostics has also been very
But
useful.
Dr. Kemi, I want to ask a question when it comes to virtual. You mentioned there was something you mentioned right now.
Telemedicine,
Exactly. How
virtual.
accurate is that? You're seeing your patient virtually, but how accurate can you assess a patient and know this is the diagnosis and this is the treatment that is relevant for that particular issue? How accurate?
Yeah, so it has a lot, there are different dimensions to it. So it depends on what kind of, complaints the person has, because essentially in our practice, it's very important to, communicate with your patients, take a
Great.
history, do a physical examination, you know, investigate, that's do tests, and then get a diagnosis.
Okay.
So based on, those criteria, telemedicine is, it can work to make those situations possible. Even via telemedicine, depending on the, how will I put it now? Depending on the grade or the
Okay.
level of
The
what kind
level.
of
Okay.
telemedicine tools that you are using. There's some telemedicine tools that can take x-rays, there's some telemedicine
Oh.
tools that can do scans, there's some telemedicine tools that, the person would have done their tests and those tests can be uploaded, and then the healthcare provider can view, the x-rays or view the scan reports, and then the person is guided. Okay. And then there are also some telemedicine um, tools that you can attach to, some particular devices that can even transmit sounds, so the way a doctor will use a stethoscope and listen to the heart or listen to the chest, there are some devices that those sounds can be recorded and they can be uploaded, and then the healthcare provider, the doctor, can listen and say, oh, okay, these are the heart sounds I'm listening to, there are no murmurs, or oh, okay, this are the chest, the breath sounds, this chest is clear, or oh, this chest is not clear, so those kind of things are possible with telemedicine depending on the device capacity, but it's better than nothing, and so like during the pandemic where there was lockdown and restrictions of movement, that is what saved a lot of people's lives, because there was challenges getting to the hospital, so it was just something that could bridge the gap. And then if the person is assessed and is seen to be an emergency, of course that kind of person has to be moved to a hospital. So it was just a bridge, but it's not absolutely devoid of its own challenges, but it's better than nothing.
For being a part of Insight today and keeping us well informed when it comes to World Health Day. My health, my right. Thank you so much. Hope I'm going to call you more on the program. Thank you. The beautiful, amazing Dr. Olukemi Olugbade. Thank you so much for being a part of Insight today.
It's been great being on your show. Thank you for the invitation.
Thank you. And of course, Dr. Olukemi Olugbade, she is a public health physician, field epidemiologist. And thank you so much for being a part of the program. Let's quickly go on a break, and part 2 returns with an interview by one of my colleague, Fauzia, who actually interviewed a doctor, Dr. Patrick Eze, who threw more light on World Health Day. That was yesterday. Stick around and do not go anywhere.
is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. To keep the body in good health is a duty, otherwise we shall not be able to keep our mind strong and clear. Hello and welcome to another edition of the program Health Guide. Today is a special day for us in Nigeria as Nigeria is celebrating the World Health Day. Global Health Days offer a great potential to raise awareness and understanding about health issues, mobilize support for action from the local community to the international stage. Hello again, and I am Fauziya Lukman today with you on Health Guide. Now, this year's theme for Health Day is My Health, My Right, as the World Health Day 2024, which focuses on the fundamental human right, access to quality health care, education, and information. To commemorate the day, we decided to take you on a wild journey to take you to a seasoned health practitioner, Dr. Patrick A.Z., to go into detail as to what the day is about and what Nigeria celebrates. Dr. Patrick A.Z., welcome to the program.
It's a pleasure.
It's been a while seeing you.
Thank you so much.
Well, you look good, by the way.
Oh, thank you very much.
So is it because it's the health day, or you just naturally just always like that?
Well, it's the health day. So we have to commemorate it.
That's very nice. So,
All right.
Mr. Patrick, I don't know. I like Dr. Patrick more.
Yeah.
It makes it collaborate with the whole health day thing and the medical practitioner.
Yes.
And it's nice that you are the medical director of the
Silver Cross
Silver
Hospital.
Cross Hospital. That's nice. So, Mr. Patrick, please tell us, what are the activities being held by the government in Nigeria to mark the day?
Well, every World Health Day is an opportunity for governments to do stock taking of what they have been able to achieve down the line in terms of provision of healthcare for its citizens. And currently, we are trying to enforce universal health coverage for the Nigerian citizens. That's the mandate of the WHO. And even though it's a very tall order to achieve, but countries try to do their best to ensure that they achieve universal health coverage. Now, a lot of countries are doing so many things, but within the country, the Federal Ministry of Health is trying to organize programs both at state and local levels, and also within the private setups to ensure that individuals key into the theme of the event. And then also there is also some activities that will be rolled out within the week across the primary healthcare centers and all that, to ensure that people have some form of idea of what this team is. Now, this particular team is very important because, for once, the WHO is trying to make us to look inwards first as individuals. So it's talking about my right and my health. And for a long time, a lot of people, it will surprise you to know that 140 countries in the world do not have health care in their constitution as something that the citizens have a right to have. Yeah, so in Nigeria, we have health as part of our constitutional rights. We've even gone further to have a National Health Act, which we got in 2014. And the National Health Act has so many beautiful legislations that is supposed to help the Nigerian citizens actually achieve a better state of health. So we have things like what we call the Basic Healthcare Fund, Provision Fund, that ensures that if you have an emergency anywhere in the country, you're supposed to be treated free of charge. Government is supposed to pay at the back, so that citizens can have that service.
Okay, but for better emphasis, can you repeat that?
Okay, so within the National Health Act, we have the National Health Act is a law that actually stipulates how the health of the Nigerian citizens will be managed under the framework of the federal government. Now, that National Health Act, within it, has what we call a Basic Healthcare Provision Fund. Now, the Basic Healthcare Provision Fund is a fund that government is supposed to set aside. Part of it is supposed to come from 1% of the consolidated revenue of the government. And the fund is supposed to be split as such. 50% is supposed to go to NHIS. So the basic minimum package for all the citizens, the government is supposed to foot 50%. And then individuals contribute the remaining. So NHIS is supposed to get 50% of that fund. Then you have 20% going to primary health care to get vaccines, drugs, and all that. Then you have another 10% for training of healthcare workers, and then 5% for emergency services. Now, which means that if the National Health Act is implemented as adopted, and these funds are made available, Nigerians are supposed to be having healthcare that is far beyond what we are having right now. So imagine having an emergency and you get to any hospital and you can be taken care of because government has provided that fund for you to have it. And there's even a fine that if facilities don't provide that healthcare in emergencies, they're supposed to pay 100,000 or go to jail for 6 months. So there's so much that is available. We have very beautiful legislations. So this is an opportunity for government. This World Health Day is an opportunity. That's why My Health, My Rights gives you it means we have to start asking questions. Why do we have these laws and we're not having the benefit of the laws that we already have implemented? Yeah.
Okay. So now, how would you rate the state of health delivery in Nigeria? Would you say it's fair, or would you say it's an exceptional thing?
So the government is trying its best, but we are still very far away from what the Nigerian citizen is supposed to have in terms of healthcare. And what do I mean? How many, if you take a look at the primary healthcare system, we don't have up to 10% of those primary healthcare structures function in the country. And we know that primary healthcare is the first point of call for Nigerian citizens in the rural areas. Not every state or locality can have a general hospital. So if you have only 10 to 15% of them working, then it means that the citizens are basically treating themselves. So there is a lot more that government needs to do in terms of primary health care. And then there's a lot that government has to do with healthcare workers. Because we're having a mass exodus of healthcare workers out of the country, at the moment. And that is happening because the conditions are hostile to keep nurses, doctors, medical laboratories, pharmacists, and there are better opportunities overseas. And that trend is not being reversed. So we may not be feeling the pinch as such now, but if you give us another 5 or 10 years, you will now see a huge lacuna, because a lot of facilities. It was reported in Ondo State recently that out of 146 medical doctors, only 26 were left. So that huge number is in foreign countries now.
Yeah,
so
the whole Japa syndrome.
So if you
now
have,
if the whole particular ones that are left now, leaving us with the older doctors.
So even the older doctors are also leaving. So the problem now is you have healthcare workers that those who are available may be overstretched. So before now, our patient to doctor ratio was around 1:26,000. So I can imagine with a lot of people leaving, we'll be doing 1 to 100,000. So it's a large number. When countries like France and UK are doing 1 to 10, or 1 to 12. So there is a lot a lot of introspection that government needs to do right now, because you have healthcare workers leaving. You have the physical structures of the primary health care structure, the general hospital structure, teaching hospital structure dilapidating. They are not centers if you really want to do an audit of these healthcare systems and how are they functioning. You see that a lot of them are functioning below par, at maybe at 20% or 30%. So that doesn't bode well for the healthcare system. So we are not doing well at all, if I'm to be truthful. And there's a lot the government needs to do in terms of taking us from where we are to where we ought to be.
Okay, so where do you think the government is doing to boost the healthcare system in Nigeria then?
So we tend to talk more than act. So there's a lot of, as we already have, I've already told you about the National Health Act, which is a beautiful legislation. It's just somewhere in the archives gathering dust. The political will to ensure that the elements of that act are implemented is not really there. Now, the other things are that government also doesn't hold those who have embezzled funds made for healthcare accountable. So that also in itself creates a vacuum, because if people have been giving funds to equip those primary healthcare centers and it was embezzled, you need to also investigate and ensure that people are held to account. Because if not, if you release more funds, you may end up having a cycle, a whirlpool of funds not being utilized for what they ought to be used for. Then the other thing is also, the last part of it is getting your citizens to also key into the healthcare programs, and then more massive healthcare education. You know, because you can have all this beautiful framework implemented, and then you've left your citizens out of the entire box of what is happening. So they also need to be involved in what is happening. So it's not out of point to have stakeholder meetings, to get people involved, to talk about the new things you're trying to do, set up cancer centers, set up kidney centers, set up, you know, centers, eye centers, make sure they're functioning, you know. Nigeria can be a center of tourism, healthcare tourism for West Africa and even the entire of Africa. Because in terms of healthcare force, we have excellently trained doctors who, when we go overseas, are top-notch in all the fields. If you want to check top performing doctors in the UK and in the US, are all Nigerians.
Mostly Nigerians.
They're mostly Nigerians. So if you already have that cadre, if you already have a system, a healthcare education system that produces doctors that can match doctors overseas, then why not just ensure that you equip them with what you need? And at the end of the day, you now can even reverse healthcare tourism, you know, and cause people to come here, come to the country, instead of having the reverse of what we have now.
Okay. So now, what would you say is the percentage of budget the government has assigned to the health sector in Nigeria, and are they being allocated to the appropriate channels? Yeah.
Okay, so let me take you back. Sometime in the year 2000, they had the Abuja Declaration. And the Abuja Declaration was a declaration where African countries, actually it happened in Abuja here, they came and then they decided, all the leaders of Africa, the heads of state, decided that they will contribute a particular percentage of their GDP to health. Now, so many years after, we're doing a tracking of what has happened so far. So you see countries like Rwanda, Botswana, and even South Africa doing as high as 20% of their GDP, 17% in the case of Botswana, and then 15% in the case of South Africa, you know, and they have been matching that fund allocated to healthcare for the last 10 years. In Nigeria, over the last 4 or 5 regimes, we've been doing between 4% and 6%.
Which is very poor.
Yeah, very poor compared to Rwanda. You know, so it will surprise you that Rwanda has one of the best healthcare systems in Africa. In fact, during the COVID epidemic, they were at some point trying to even produce COVID vaccines. That was how far and how robust their healthcare system was. They had robots managing COVID patients, you know, in their COVID centers, you know, and we were still here focusing on face masks and all that. So healthcare is something you have to be intentional about. It will not just happen, you know, because if you're hoping and praying that, well, to sort itself out, it will take care of itself, it will never do that. You have to be intentional, you have to lay the framework, and you have to have the political will to ensure that that framework is implemented, and then also manage the consequences of that implementation, you know, and ensure that the citizens, who are those that you want to bear the fruits of all this work, get that service or get that benefit from all this implementation that you're trying to do.
Okay. Now, a look at the prevalent health issues we have in Nigeria. We have the HIV, the tuberculosis, malaria, maternal health, child care. Now, are they being improved or status quo?
So, with regards to HIV and AIDS, recently our government implemented a rational report and said that NACA will now be will now be put under the NCDC. So that, and currently, HIV is a heavy donor-supported area. So that means that you have USAID and World Bank contributing 3/4 of the funds that are going to the treatment, drugs, management for people living with HIV. Now, if you have donors, and the donors are doing that because you already have NACA as a framework, so they can inject that funds into NACA and ask NACA for accountability, for those funds. So if you subhume that piece of NACA under another parastatal or another agency, you tend to tell the donors that we don't have that problem anymore. And then if you have HIV, you better go and start trying to buy your drugs. Because if I'm helping you and you are not, I don't know if you understand, you now are not giving us the benefit of doubt that you're taking this problem as seriously as it should be taken, then that means if NCDC if the activity of NACA is so insignificant that you can subdue it under NACA as a department, then why are we donating $800 million every year for HIV? So some of these things send the wrong signal. I think it would have, in the future, some of these decisions should have been made with statistical data. Are we really winning the fight on HIV infection? Are we having good prevention of mother-to-child transmission? What's our rates? What are our rates like? What is the rate of, are there new infections coming up? Now, if we have new infections, how many years will it take us to get to the point where the country can take back the management of HIV and AIDS for its citizens from these donors? Because once you do that, you truncate that process. At the end of the day, what happens is your citizens will suffer. And then you may now start having an epidemic that is being controlled, roaming out of control. So HIV and TB are in the same category because TB is an illness that is also came back because of HIV. So if you are very intentional about these illnesses, you have to lead the direction. You don't just throw policies up and down without ensuring that your citizens don't suffer at the end of the day. When it comes to child and our mortality statistics for children and under fives is still very poor. It's still very poor. It's very poor because when you don't have centers, if a child, for instance, is having gastroenteritis, is purging and stooling in one remote part of the country, what are the chances that there's a primary health care center that can attend to that child, that is functioning and has the staff that will be available to take care of that child? If any child has that problem right now, I can tell you that it's a 70-30 chance that the child will survive.
The parents are left with the option of just performing
first aid. Yes, and it is first aid that's gotten the population of the country to the point that it is. So if we're here now, even in the FCT, in the suburbs, what are the primary health care centers, are they functional to the point that the child has that problem? Now, can that child get that service? If the service is available, will the parents have the resources to pay for the treatment of that child? So these are the complexities, So you see, already we are in a system where we may not even have functional healthcare systems or functional healthcare facilities in those areas. And then there is the out-of-pocket payment that the parents are supposed to pay. So it lets you know that there is no way in a system like this with this kind of variables that children will have problems and not die from this issue. So when you see maternal and child health statistics being very poor or very bad in the country, sometimes people say it's because we're trying to get funds or trying to attract foreign donors and all that. But in reality, that is the truth. The truth is we have very weak systems that need to be strengthened.
So lastly, how and what do you think Nigerian citizens can be able to get access to the health and the right they deserve, being that it is the World Health Day?
So I think that as Nigerian citizens, we need to actually hold our leaders to some accountability. Because no matter how wealthy you think you are as an individual in this country, if you may have certain emergencies that will require at least first aid in some facilities. And you may be lucky to afford the big facilities, the Cedar Crest and all that. But how many people, how many citizens can afford that? Very few. So we need to start as a citizenry asking our leaders, why do we have these laws and we're not seeing the benefits? Why are they not being implemented? Because if we do not ask our leaders those questions, they may not take it. It may be that they may be interested in implementing it, but nobody has asked. You know, so part of your right on this particular day is to ask those questions. You know, why do we have primary healthcare structures that are run down? In fact, I will even advise Nigerians to go on social media. If there's a primary healthcare that's run down close to you, you take a picture of it and put and say, this facility needs help.
Cool.
Maybe government
At this point,
will
I
see.
think
Yes, because that is it.
It's the World Health Day.
It's the World Health Day.
We're creating more awareness. Because the role of the whole thing is to create more awareness for us to have the right to the health.
Yes, because if those things are not working, then how do you get the health care that you deserve? And you know, unfortunately, health and its antecedents happen to you. So you may be healthy today, and then all of a sudden it happens, and you need that service. You know, so if the services are not being provided, or the standard is too poor, you might end up becoming a casualty for something that should have been very simple for you to solve. You know, so that is the rule that I implore all Nigerians to make. I'm not going to call for protest, but know that today is your right. If there are structures around you, try and drag government. It's not even out of place to even meet your councillors. Yes, it's not. You're not saying anything bad, but our councillor, our primary healthcare center it's not up to beat. They don't have drugs, they don't have this, you know, and then try and push them, you know, to make those structures better. You know, as a private facility, sometimes we also try to support the activities of primary healthcare structure by putting facilities in hard-to-reach areas, so that even if you have primary health systems that are not working, if they are incapacitated by equipment or by service, they can find their ways to comprehensive centers in those rural areas and get the services that citizens need. But government also needs to take the driving seat. You know, there are a lot of things government can do, even with private sector. You could do public-private partnerships. So, government is good at building, but they're not good at maintaining. So, if you are finding it difficult doing that, you could develop a PPP with private sector. That's okay. We have 20 primary health care facilities. Can you help us manage them at low cost, so that we can provide the services that this community or this state requires? You know, that's what is done everywhere in the world. You know, so these are best practices that we may need to emulate, you know, if we want to move the country.
All right, now you're welcome back. Thank you so much, Dr. Patrick Eze, and of course, my colleague Fauzia, who actually conducted that interview on World Health Day, saying my health, my right. Hope you were well informed and hope you understood what it is for you to have that right when it comes to healthcare, health facilities, for you to ask questions when it comes to health. Of course, this is Insight Today. I am Jumai Manson. Thank you all so much for being there. Bye-bye.